And today we wanted to talk about things you should stop going to your doctor for.
Yes. I know.
Before we get to that,
Okay.
I think we should dive into a little bit of like why we're about to say what we say. Like kind of how there's just different ways to think about your health. There's different ways to decide how to manage what's going on in your life, whether it is like pain or like just other parts of your, like you said, health as a category.
Everything. Pain, feeling, mental state, just like digestion, cycles, like all of the things. Like there's just different ways to manage them and different way to perceive them and make a reaction to them out in life.
Right, and I'll share a little story with you guys. Like I can't speak for Dr. Johanna, but one of the reasons like I became a chiropractor and I choose to live a different lifestyle than other people, than like our mainstream medical model, is because we were pretty early on in our life exposed to a different way of health, to actually like take ownership over our health and to make active choices and not just wait for like a diagnosis or something to happen. I'm very fortunate in that didn't come from like my mom just one day waking up and being like, oh, let's live this way. Right. It was because like one of the things is our grandfather got diagnosed with cancer pretty early on in our life, and they changed their lifestyle, which gave him quality and quantity of years for sure. But just learning through that process and learning each more a little bit and adding it on. And I see, and we talk to so many people who they don't even know, like there's other ways out there or really how their body works. Right. And we just want to touch on that a little bit because we want you all to know how you work. We want you all to make the best choices for you. If you're like just like fed up, you like don't want to be on drugs and medication, you don't want to look at surgeries, you want a good quality of life, you don't want to stop doing injections, like all of these things. If you have like medical questions and nobody's giving you answers and nobody's helping you, like just know there's a different way. So we're gonna throw you into that loop today and start to challenge you a bit.
Yeah, so, and I think a perfect example of this is I was talking to a patient the other week, and he was telling me that one of his friends went to his medical doctor, his primary, and he had some stuff going on. I think it was with heart, if I'm not mistaken. And the doctor like prescribed him this medication, and he had like a really negative reaction to it. And so he had to go back, and he was like, I can't be on this medication. I don't want to be on this medication. Is there anything else I can do for my heart condition? And the doctor said, oh yeah, you can exercise and you can eat healthy and you don't have to take this medication. So the patient would have never gotten that information if he never asked. So I know we've ranted about this before, like you hire your doctors too, so you can ask the questions, and there may be alternatives out there than medication. And you know, there is a time and a place for all medication. I know we both truly believe that. We're not beating up on that, but it definitely can be overprescribed, and it's a slippery slope because once you get one, you have side effects, and then you're usually left with another. And if you look at the stats on how many medications people, I believe it's like 65 and over or on, it's like over a dozen, and that is the age range on where a lot of these like interactions are happening with drugs and stuff. So anyways, just coming back to like full circle, what we're talking about is how to empower you on your health, how to live a healthier lifestyle, how to know that there is a way to improve quality of life as well as quantity in those years if that's something that you want. And that changes with you each and every day in the daily decisions that you make.
As most of y'all are watching this are adults, you get to choose. So your belief's gonna come from before, like maybe like your parents raised you a certain way and they educated you about that, because that's all they knew. Yeah. You're an adult now. You get to make your own choices. So if you're not comfortable with something, or you don't like it, or you want different answers, know that you get to actively choose that and create that new environment for yourself, which is a new experience. And what's really cool about this is it changes your kids' lives. Changes their lives.
It does. And I think about that each and every day when I wake up, and we're at 6 months today is Dakota's 6-month birthday, so he's half a year old, and we're starting to play around and introduce solids, but I make sure that when I'm thinking about that stuff, what does that mean for him? Like, what are the first foods am I going to give him? Like, what am I going to expose him to? And I know if Dr. Liz is still on here, she can comment on this. I just read a post by one of this chiropractor that we went to school with, and he just took his daughter to school, and I don't know what age she is. I think she's in elementary school. And on Tuesday is like Granola Tuesday, where they get a granola snack at lunch. And this family is the only one that sends another snack in with their kid. And so the chiropractor posted the ingredients of what the granola stick is that is given to every other kid in that class, and the alternative that he gives his daughter. This one had like 20 different ingredients. Half of them you can't even freaking pronounce. And this one had three things. And anyway, his post goes to say that he has exposed his daughter to these foods, but she knows how she feels when she eats bad food, and she knows it causes a tummy ache, and therefore she knows like to control how much she eats at a very young age and not to overindulge. So it is like you can train your kids too.
Yeah. So let's dive in a little bit on like how we think of health a little bit differently before we get to like the nitty gritty of like things that maybe you shouldn't go to your normal doctor for. And remember, this is not like medical advice. This is like from personal experience. We like to educate on this. Ultimately, you're responsible for your own health, and you have to make whatever decision that is comfortable within you and your family and works for y'all. But if you ever want to talk more, like we're definitely open to that.
Yeah.
So one, we are chiropractors. So if you have never been to a chiropractor, if you've never come and talked to us, we work with your spine and your nervous system. So your nervous system literally controls everything in your body. And I think like the most, we'll try to keep it like super simple, but like your brain tells everything what to do, right? Yeah, it's going to send those messages out, and those nerves that are sending those messages out are going to communicate with muscles, ligaments, joints. Your cells are going to be influenced, your hormones, all of that. So if you think that stress throughout your body and your life doesn't play an effect on that, like we're here to tell you that it does. You can pretend all day long, as much as you want, that your nervous system, that if stress is on it, and the things that we do don't matter. But great chiro guy, Sid Williams, said whether you believe in chiropractic or not, it's like gravity, it still works. So it's pretty awesome. So we look for stress in your body to help with that, so your body can function like it's supposed to, so it can have the best chance of healing whatever like cold or flu or injury or aches and pains that you have. So anything you want to add on to that?
I mean, it's just very simplistic when you break it down like that. Like chiropractic can help change and improve your overall health and wellness. And I just have had more people come in recently that are seeking out chiropractic care to maintain a healthy lifestyle. They use it, these patients are using it to make sure that they stay healthier, stronger, that they're getting sick less often. So they're using it as a preventative measure, which is one thing that we love to see in our office. We're just not treating aches and pains and discomforts, because out of your whole entire nervous system, only 10% of that controls the way that you feel roughly.
And the rest control.
The rest controls the function of the body. So that's when things like your immune system, your sleep, your hormone production, hormone control, digestion, breathing. I mean, one of the reasons I got into chiropractic is because chiropractic was the only thing when I was a kid to help me with my asthma, to help me breathe better. I didn't have to be on those, really, the steroids and different things that were negatively affecting my health. And so and I've heard that story time and time again from other people that I share that story with, and they reach out to me and say, oh, that's why I got my son or my daughter under chiropractic care, and it helped, and it made a huge difference. So we are like helping in all kinds of different things. And I think one reason that we like to talk about this stuff, and it's near and dear to our heart about making a change in perspective too for me, and I wanted to touch on this, is that sometimes we do get patients that have been under care, or someone out in the community you may come into contact with and you're talking to, and they may say like, my doctor told me not to see you. My doctor told me not to go to a chiropractor. My dentist, my physician, my family care physician, my OB, my insert, whoever you want to insert here. And that's really, really unfortunate. It's not fair to the patient, because I think that we always put the right step forward in this office, that no matter who you want to take part of your health team, I encourage you to do what you're comfortable with. So that's making sure that your healthcare providers are a good united team and they're working together. So we always want to co-manage with people. We always want to help the best for that patient. And I think that I always ask patients like, well, why did your doctor say that? And they don't know. And I think it's because most people are not, and other professionals are not educated on what chiropractic is. They see all these YouTube videos of like this crazy cracking and all of this force being applied, and like, that's not what we do here.
Yeah. If you want to hear cracking and go watch a YouTube video, I mean, like, adjusting is awesome. It looks cool. It's great. We do a great job at that. We do it here too. We don't just always put it online. But there's so much more into it, so much more. And there's like so much to know, like where to adjust, when to adjust, how much, to actually get the changes that we're going towards, which you don't get in a YouTube video. And you don't even see the exams or consults on there. And I've definitely talked to patients who have never had an exam or a consult at other offices. So I can understand why there's that like idea out there about it, by all means, but we're here to tell you, at least in this office, we can speak for ourselves. We do those things, so we're actually addressing what needs to be addressed with our patients. But
yeah, and also, like, I mean, just like every other healthcare professional out there, like, we don't go and get a degree in like a weekend. Like,
no.
we have to have an undergraduate degree. You have to go to a doctorate program that's nonstop, that requires clinical hours and all of that stuff. So, like, we're very, very trained in what we do, and we also take additional trainings to make sure that we are up to par on children, on jaw stuff, TMJ, and postpartum moms, and pregnancy, and all of that stuff to make sure you are getting the best care possible.
So let's dive into that in a second, but let's go over, like, so we talked about kind of like how we are different. Let's talk a little bit more about that though, because I think in mainstream medical society, or like when we're raised, like in the environment we were raised in,
Sure.
you know, you were like, you wake up and you feel good, so you must not be sick. There must not be anything bad happening in your body at any point. I like to challenge you to think of your, throw that out the window and think of your health on a scale of like 0 to 100.
Okay.
And some of y'all have probably heard me say this before. 0 is like, you're dead, right? 100 is, you're vibing, you're thriving, you're like, you're just...
I feel like I don't remember if we did this when I was very pregnant or if I was just recently postpartum, but I'm excited to do it again because I'm feeling less like better than what I was before.
Every choice you make, every single time in your life, which we talked about, you're adults now, you're watching this, you get to make whatever choice you want, right? So whatever food you eat, however you manage your stress, if you're getting adjusted, if you're exercising and working out, all those things are leading you one way or another on this scale.
Sure.
So oftentimes we're like, oh no, I've seen this actually a lot recently. Oh no, I don't have a thyroid condition, or I don't have this autoimmune condition yet. My doctor's like, let's just wait, and we'll run some more tests in a little bit.
Oh, I can't even, like,
Guys,
that drives me insane.
Please realize every single day you wake up and you make choices, it's moving you one way or another towards that diagnosis. You did not wake up one day, 100% health, embodied health, and then the next day you had cancer, or the next day you had lupus, or the next day you had the cold or the flu. You name it, an ache and pain, a degeneration, I threw my neck out, whatever. That there is stress and there is choices within that process, and you are in control of them.
Right. Absolutely. And then, not that we're not saying that you can be immune to everything. Like, it's actually really good if you get sick. Your body's doing its job. We can't prevent everything from happening, but you can give your body the best fighting chance to heal quickly, to be sick less often, to be sick for a shorter period of time. To have
quality of life, because we have a lot of patients
quality.
Too. If we ask you how old you want to be, a lot of people don't want to live to be that old because they think their quality of life is going to be crappy. It doesn't have to be.
So I know we didn't mention this earlier, but obviously show us some love, get some emojis in there, show Dakota that you're missing him today. If you're watching this later, make sure you comment on replay. But also, I wanted to mention, of course, like, I went off on a tangent, so now I'm like, oh crap, what was I gonna say? But
postpartum, where do you fall on the scale?
Oh, on postpartum, I fall closer, I think, to like an 80 to an 85 out of 100 now.
That's awesome.
Yeah, before, like, when I was first postpartum, I think it was like a 40 or a 50, because, like, I was super sleep deprived. I mean, I'm not sleeping as much anymore still, but we're getting some sleep, so it's improving some with that. And then I have been able to get back to physical activity, which helps all kinds, just like mental state and all that kind of stuff. So yeah, but I was gonna say, drop down how old you feel like you are. Put your age in the box. No one knows you, so it's fine. But, like, I would say, like, well, I don't want to release my age, really. So anyway, I feel like I'm probably, like, the age that I feel. Maybe I feel a little bit older than what I should, because I'm still not sleeping 100%. But each and every day I do make choices toward that, and we're trying to get back to a normal, more regiment type of life in my household, and it's just a work in progress.
Okay. I know we've been going for a while, so let's talk about the thing you came here for, which is, like, things you maybe should not go to your normal doctor for. Remember, this is ultimately your decision, and we haven't done, I'm not speaking for you, especially if I have not done an exam or anything like that, and I still always discuss with our patients. It's ultimately their choice and what they're comfortable with. But some things that we see, and I see it, like, in our office and out in social media land and just talking to people, pain that drives you to the ER, because we're really good with getting you out of pain. Like, the chiropractic turns off that pain signal. We can get you out of pain faster, and we can actually work on actually fixing the problem, depending what it is. Of course, we would do an exam and consult and tell you that.
Right.
But if you go to the ER, they are, one, going to get you in and out as fast as possible. They are there to save lives. So you're probably going to be sitting for a little bit, even if you're excruciating pain, because more than likely, all cases are different, your life's not on the line, I'm going to guess.
Right.
And they're going to give you essentially a muscle relaxer and a huge steroid
anti-inflammatory,
something like that,
or maybe an opioid. I know they're
I think they're getting away from that a little bit, which is nice. And
I'm watching myself on
those will definitely, like, for some people it'll turn off those pain signals. It doesn't for all people. I've talked to people who it didn't even help their pain, it didn't even touch it. So instead of going and waiting hours and spending buku bucks, can see a chiropractor or like a PT or somebody who can like get you out of pain faster and actually work on that musculoskeletal problem, which is more than likely where it's coming from.
Right.
What's some other ones that we see?
As far as pain,
or not just pain.
Oh, just going to, okay, so like, for example, a lot of times I hear like, because we see a lot of kids and families, like, I took my child to the pediatrician for scoliosis, for bedwetting, for headaches,
for back pain
and neck pain, and we have been having kids come in younger with back injuries or neck injuries, and I'm gonna say, just in my gut, this is probably related to sedentary lifestyle and to technology and all of that stuff, but they go to their mainstream pediatrician because of course that's like the general way you should go, typically, is what we're taught, but they don't know what to do for them, or they think that sometimes it's in their head and they don't really have pain because they're young, but the lifestyle that we live and the choices that we make can result in aches and pains and discomforts even at a very young age, and we are amazing at helping those things without putting medication and things like constipation
and like acid reflux and stuff in babies, because they're getting just put on nasty medication for like they're a baby and they're on medication for the rest of their life because they're not able to digest properly, and we just look at where they're stressing their body. A lot of times if they're stressing that lower back where those nerves go to their organs and we take that stress off, a lot of times we see that get better.
Yep. Absolutely.
And then pregnant mamas,
ladies,
they're already not prescribing you medication anyway, so that's pretty nice, but you're still getting aches and pains, or you're having anxiety and those type of things with all this new change that's going on in your body and that's coming up in your life. So here, not only do we help with the aches and pains, we have special training for that, but we're also going to talk to you about your mindset and fitness and like preparing as much as possible for that physical part of labor with physical, emotional, spiritual, and then how do we support you postpartum.
I think we also should do a segment one day on like the crap that I read on Facebook, because I also saw on Facebook the other day that a pregnant mom went to a chiropractor and she didn't like the answer she got because at this chiropractic office they weren't trained in pregnancy, and they told her that she needed a steroid shot, and I was like,
we're gonna do that one day.
Yeah, so even though you may read stuff online, it doesn't necessarily mean it's the most accurate, so make sure you do your research.
Yeah. So it's a lot of information. We threw a lot at you because we're here to challenge the way you think and shake it upside down and try to get you to take a step forward in the right direction to taking control over your health. And if you are genuinely interested in not being taken care of it through drugs and medication, and you want different options and you want to have different discussions, like that's what we're here for, and we're here to challenge you in that way.
Yeah.
So then when you are experiencing this, or you know a friend who's experiencing this, you guys can all give each other different options and live better lifestyles for better quality of life, and you're not junking up your organs and your body with medication that does have side effects. And again, there's always a time and place for some things, but
so remember what your health score is. Give yourself a rating. If you want to be closer to the higher end and you're not sure how to get there, just ask us. We don't know it all, but we can give you some general tips. We can give you some resources to move you
in the right direction,
in the higher direction. And that is your Twin Tuesday.
Hope you enjoyed it. I know it was a lot. We appreciate and love you all, and we will see you next Tuesday.
Bye.